Morning, and thanks for joining us for another edition of At Issue. I'm Matt Pritchard, in for Corey Smith.
And I'm Sue O'Connell. Coming up, our government's evolving drug policies.
We're going to take a look at the Biden administration's push to reclassify marijuana as a less dangerous drug, plus prisons giving inmates drugs to help tackle opioid addictions. And
Middlesex Sheriff Peter Katujian joins us in studio. First, before we move forward, let's look back at what was at issue last week.
Communities across the Commonwealth pushing back on a state law that aims to build more housing near public transit.
Strong views in Wakefield and throughout Marshfield and Rockport. Attorney General Campbell, she's prepared to take whatever actions necessary to ensure a smooth and complete statewide rollout.
Well, former President Donald Trump is being held in contempt for violating a gag order. This stems from a series of posts Trump made on Truth Social concerning his hush money trial.
In a matter of days, outdoor dining resumes in Boston, but not in the North End. It's restricted in that area, and today restaurant owners took a cheeky approach to draw attention to that fact.
And a new path for migrant shelter funding in Massachusetts. Governor Maura Healey signed a 9-month limit on how long families can stay in emergency shelters.
Campus protests in Boston and Cambridge as pro-Palestinian demonstrators continue to clash with universities.
And more now on the move by the Biden administration to reclassify marijuana. If fully approved, it would impact research efforts and potentially the cannabis industry right here in Massachusetts.
Yeah, for more than 50 years, marijuana has been listed as a Schedule I drug classified along other substances like heroin, and it's seen as having no currently accepted medical use and a high potential for abuse.
The DEA is taking steps to reclassify the drug to a Schedule III, a category that includes ketamine, testosterone, and Tylenol with codeine, and would make it easier for researchers to study marijuana for medical benefits.
Let's talk more about the significance of this move.
That's right. We are joined by Shalene Teitel, is a former commissioner of the Massachusetts Cannabis Control Commission and founder and director of the Parabola Center for Law and Policy. Dr. Stacy Gruber, a director of the Marijuana Investigations for Neuroscientific Discovery at Mass General Brigham McLean Hospital, and Tito Jackson, a former Boston City Councilor who now runs the Boston Cannabis Dispensary, Apex Noir. Thanks for all of you being here today. We sure appreciate it.
Great to be here.
Yeah, of course. So let's talk with Dr. Gruber first and start there. Obviously, you've been looking at this for years on end. How does this move change how we research this drug?
So first and foremost, it's important for people to understand that one letter makes a world of difference. And rescheduling is not descheduling. And I've had a ton of people misunderstand what is now being proposed. Descheduling is very different from rescheduling. First and foremost, it's important to recognize what this signals to the entire nation, which is that we've moved from a Schedule I substance, as you appropriately point out, no accepted medical value, to Schedule III, accepted medical value. That's a huge difference in terms of the perception. That's a very, very big change. Sort of harkens back to where we started in this country long ago. It was legal and prescribed, part of our pharmacopoeia in 1850. But what it means today in terms of research really has more to do with the, I would say, behind-the-scenes administrative regulatory burden than almost anything else. There's a bit of a misperception about what rescheduling means for researchers, clinical researchers like me, in terms of being able to assess or study the effects of cannabis. It doesn't mean we can study the products that our consumers or our patients are getting in dispensaries. It does not mean that.
Wow.
It does not. It does not mean that we can, do anything any way we want and that our patients and consumers can get products anywhere. That's not what it means either.
Well, Shalene, I wonder your take on just how this changes the research arm of all of this.
Well, I think that it's largely symbolic. I mean, I think that I would defer to Dr. Gruber on if there might be a stigma that is lifted and maybe more funding for research. But on paper, there's not much that changes legally when the schedule changes.
So, Tito, we know now from history how marijuana ended up being associated with heroin rather than with some other drugs that aren't necessarily as dangerous. Can you refresh our memories?
I could give you a little bit, couple pieces. One on the 280E side, which is, as a business owner, one of the things that actually really, really harms us. There was actually a case down in DMV area, and there was an individual who actually sued the federal government in court. I'm sorry, they actually brought him to tax court, and he actually was able to win. And then that's kind of how 280E happened. But in terms of the the scheduling from back in the good old days. A lot of this, sadly, had to do with race. Had to do with a lot of money and the folks who were involved in it. And if you are a jazz fan, a lot of interconnectivity in that space.
Yeah, and we should note that it wasn't until the 70s that it was classified this way, and it was done for what seems to be political purposes. Doctor, can we talk a little bit about the science that we know? You know, we have talked a lot about, during the process here in Massachusetts, some folks were concerned that teenagers would be using marijuana more often. Obviously, the marijuana today is different than the marijuana I may or may not have used.
Of course.
When I was a teenager in the 70s, there's been concern about kids having psychotic episodes, the level of THC content. Can you address any of those concerns?
Any and all.
Because we don't have, research to help us. It's your best ability to determine it, right?
Sure. We actually do have a fair amount of research, and it's important to sort of keep in mind that everything we know about cannabis comes from studies of recreational consumers. That's very, very important here. Recreational, primarily young, healthy recreational consumers. And so when we think about the impact on the young developing brain, and we've spent a ton of time on this in our lab, what we know is that the early exposure to cannabis, like other substances, like alcohol or injury or any illness, results in perhaps not the most optimal performance later on, right? It's a vulnerable system, or like we like to say to our cannabis audiences, half-baked, right? So we know that that's a concern. Increased access very often means increased use. However, we don't necessarily see increased rates of use in states that have legalized medical and recreational or adult use. That's important to keep in mind. In terms of what we know about the science, we know that, again, age matters. When people are using cannabis makes a huge difference. What they choose and the reasons that they're using makes a difference. That dictates the product choice. Today's cannabis is not cannabis from the 70s and 80s. We have exponentially more, quote, potent products. Potency here is usually a proxy for THC or delta-9 content. That's the primary intoxicating constituent. Note I didn't say psychoactive. Anything that works in your brain is psychoactive, intoxicating. And that's usually what we're worried about when we worry about the harms.
Charlene, let's turn this conversation over to the business side of the coin and just the impact that this move could have on the cannabis industry here in Massachusetts. What do you think?
Well, the main, most significant benefit is that there will be a big tax break for all cannabis businesses, large and small, and that's going to significantly improve their profitability, which is important because especially small and social equity businesses are struggling now. But I think it's very important to keep in mind that moving cannabis from Schedule 1 to Schedule 3 does not change the criminalization at all at the federal level. So even if you're following all of the Massachusetts rules, if you're using as a medical patient, as a recreational user, if you're running a licensed dispensary, you can still be arrested, prosecuted, deported. None of that has changed.
Tito, I want to talk about the politics. You're a former lawmaker, former politician. Joe Biden, of course, as a senator, wasn't exactly Mr. Yay marijuana, but now as president has made this move, which is somewhat symbolic in some ways because of the federal state laws that we won't get into. But do you view this as a purely political move by Joe Biden during this campaign, during this presidential campaign? Or do you think that this is just a natural elevation? Or D, all of the above?
I would say hopefully all of the above. This obviously there is a campaign that's going on, but when you look at it, Kamala Harris said in the first 100 days they would actually do what we're talking about. So some people think it's for the campaign. I actually say we're a little bit late on this promise, and it's a really important component. And as Charlene brought up, 25 to 50% tax rate at the federal level, and then stacked with a 20% tax rate at the local level really does make a huge difference. So on the political side, I think it's the right thing to do. And by the way, I would submit this is probably the only bipartisan issue that most of us can actually agree on. And if they can't agree on it, I have some things at my store that can help people agree.
Charlene, I'm also curious on the business side of the coin, just with federal laws getting involved here. I mean, what impact does that have on states, how they've each sort of taken an individual approach, and specifically here in Massachusetts?
Well, there was a poll that came out last month from Massing Polling that showed 60% of people in Massachusetts think legalization was the right decision. 65% think it's being regulated well. That is all based on our intra-state system where it's regulated by the state. But many things would change once we have federal legalization, which we want. We want descheduling. We want marijuana to be taken off of the schedules like alcohol and tobacco. But what would change is without protections from Congress, our social equity plans probably couldn't survive. We'd have imports from other states. We'd have large companies that have been responsible for addiction and other industries entering the industry. And so it's really important that if we like what we have in Massachusetts, that we're proactive about protecting it.
Shalene, what would you like to see? What are the next steps? I mean, how can this reclassification and then the minimizing of criminal sanctions for usage on the federal level, what more would you like to see the federal government do, and how would that impact you on the state level?
So there's two things. So one is individuals have to get involved, just like they have on the state level. So the DEA will have a public comment period once this is final, and that will be a rare opportunity to get on the record and say what you want federal legalization to look like. So people should take advantage of that. And then they should also talk to their legislators. We're very lucky Senator Warren and Markey have been leaders in federal reform, but we want to see legalization bills that protect what people like here in Massachusetts.
Just in terms, I guess, Dr. Gruber, let's go with you. I mean, what would you like to see things look like in the future as this sort of rolls out? What specifics come out of this as you go forward?
I think there's so much that we don't that we don't know. Yeah. Empirically sound data is lacking in so many areas, and I think policy outpaced science, and now we're all playing catch up. And so there's a lot of work to be done, but there's a lot of great reason to be enthusiastic and encouraged by what we already know. It isn't one thing. Cannabis isn't one thing. And here in this state that is so often leading the charge, if you will. We're first in so many things. We really should be leading the charge there. I'd like to see Massachusetts take its rightful place as the leader of the pack, not following the leader of the pack in this particular area. We're home to the very first program that looks at patients using cannabis for medical purposes longitudinally. There's nothing like it in the country. Yeah. Well, I'd like to see that expand.
Tito, on a regular basis, we see civil rights advances based on things like a woman didn't get to pay her taxes correctly because her same-sex partner died and they weren't married. Oh, let's be able to tax them. Same-sex marriage is legal. What do you think is going to happen here in Massachusetts and nationally that there'll be a tipping point that sort of the war on marijuana, at least, will no longer be?
Well, I would hope that at the federal level, they begin to follow some of the things that our governor just recently did. At the lower level, I believe folks shouldn't be making millions and billions of dollars in this space if people are still getting incarcerated, still serving federal prison time. So I think that's a critical component. I would actually like my friend who's a doctor to actually be able to be a doctor and actually do FDA studies that actually allow for people to harness the medicinal aspects of this. And I believe that the state of Massachusetts can lead, as noted, and not follow in this space. We lead in the hospital space. We know a little bit about computers and hardware and all that. That allows us to actually put those things together and really be a leader in the United States.
Shalene Teitel, Dr. Stacey Gruber, and Tito Jackson, thank you so much for all three of you joining us today.
Thank you.
Thank you so much. Appreciate it. Well, up next, from marijuana to the opioids epidemic.
Giving drugs to inmates to treat addiction is showing signs of success. We're going to speak to Middlesex Sheriff Peter Katujian on the mental health and addiction challenges at his house of correction.
Don't drive dirty. Prestige Car Wash, home of the free vacuum. Join our VIP Wash Club for just $19.99 a month. Wash your car every day. Cancel anytime. 22 locations in Greater Boston.
Free vacuum for everyone! At National Forest Direct, get 1 room of genuine Mohawk hardwood flooring installed for just $9.99. The floor you've always wanted for just $9.99 with no interest for a full year. Call National Forest Direct at 888-400-FLOOR. We bring the store to your door.
Reignite your passion with custom anniversary bands from the Jewelry Exchange. 2-carat Fancy Lab bands, $14.90. 1-carat Classic Natural bands, $9.90. Half-carat Natural, $4.99. Unlimited choices guaranteed to appraise for double. The Jewelry Exchange, Sudbury.
Toyota has more hybrid all-wheel drive or four-wheel drive models than any other brand, like the RAV4 Hybrid with up to a 566-mile total driving range. See your New England Toyota dealer, your hybrid all-wheel drive headquarters. Toyota, let's go places.
With the Freestyle Libre 3 system, know your glucose levels. No finger sticks needed. all with the world's smallest and thinnest sensor. Manage your diabetes with more confidence and lower your A1C. Try it for free at freestylelibre.us.
I really love it here.
Boston police officer is dead. His girlfriend charged with murder. The prosecution says she hit him with her car and killed him, but the defense says she's the victim of a massive cover-up. Now, the trial is underway, and NBC 10 Boston is taking you inside the courtroom. See the evidence, hear from the witnesses, and get expert legal analysis as this saga unfolds. Canton Confidential, the Karen Reed murder trial. Continuing coverage, streaming on NBC Boston News Channel.
Join our VIP wash club. Only $19.99 per month. Cancel anytime.
Prestige Car Wash, home of the free vacuum.
Wash your car every day.
Cancel anytime.
Free vacuum for everyone.
NBC 10 Boston. Sports coverage and news worthy of you.
Well, you may not hear about it as much as you used to, but the opioid epidemic remains a nationwide threat.
Massachusetts health officials say opioid deaths on average have increased 3% every year since 2015. In 2022, the last year full records are available, more than 2,300 people here died of overdoses.
Now, those outcomes don't stop on city streets. The issue is prevalent behind bars as well, but progress is being made in treating inmates for those addictions. Joining us to talk about this effort is Middlesex County Sheriff Peter Katugian. First off, Sheriff, thank you so much for being here. I think that's the important first thing to start with. But the second thing is, I'm from California, and sheriffs there, perhaps a little bit different than sheriffs here. So for those that maybe aren't aware, I guess, what does your role look like here in Massachusetts?
Sure. The idea of sheriffs is different from state to state. Yeah. Here in Massachusetts, I think we have the blessing of focusing more predominantly on the correctional side of things. Mm-hmm. Sheriffs everywhere, sometimes they'll have power of arrest and patrol powers. We don't do that here in Massachusetts. We have, each city and town has its own police force. So we'll take those people that are turned into the courts and given to us by the courts. We'll house people that are sentenced up to 2.5 years to the House of Corrections, and all those that are pretrial right now across the state. We also support our local police with warrant apprehension teams and SWAT teams and assets as they need, only to supplement and support what they do every day.
Sheriff, I remember one of the first times we met, you said to me, this is probably 8 years ago or so, that running the Middlesex House of Corrections was like running a substance abuse program, that it was the biggest substance abuse program in the state. I'm wondering if you have any statistics on how many inmates first arrive there with some sort of substance use disorder.
Yeah, well, actually, it's both substance use and mental health. Right now, the 3 largest mental health treatment facilities in the entire country are L.A., Rikers, and Cook County jails, and we're the largest mental health treatment facility in Middlesex County as well, which is a sad statement on affairs and what's going on with our justice system as well. But yes, 56% of those that come into my custody already have a pre-diagnosed mental illness, but about 50% also have a diagnosed substance use disorder. But that number is much higher of having some type of addiction in their lives and it leading to justice involvement as well.
And of course, we've talked also in the past about it's a house of corrections, and one would hope that there is help being given to folks who are the inmates there. Do you have any info on how much progress inmates are making when dealing with their addiction issues? Oh, yes.
We have a really robust set of programs and medication-assisted treatment, one of which we use all 3 forms of medications used to treat opioid disorders. It is something we're really proud of, and we've shown statistically significant results, which we're about to be published soon. This will be about the 7th time we're published in the Middlesex Sheriff's Office, showing that there has been a reduction in recidivism, meaning being reoffending once you're out. But also, more significantly, that's a great metric that we use in the law enforcement. But the real metric we need to use now with the opioid crisis is those that we're able to save from overdose death. And so we've also shown that there's been a statistically significant reduction in overdose death when people participate in these programs. programs as well.
It's hard to find someone who isn't touched by someone who has an abuse disorder, and I think we all have experience with people getting medications from their doctors, or if they're in a detox or in a treatment program, they get medications to help them deal with their illness. Does that happen?
Yes. So actually, what we do is, if you are on a prescription for methadone or Suboxone prior to your becoming incarcerated, we will maintain that prescription based upon the recommendation of a clinician, not us. And then also, if you're just about to leave and you want to participate in a medication-assisted treatment program, then based upon the consultation with a clinician and the recommendation, then we'll put you onto there too. But the fact is, medications aren't. Medications are what got us into this problem, right? Everyone thought that the oxys and the perks were going to solve the problem of pain and have no addiction and no side effects. Well, that was completely wrong. Medication is really important for the treatment of opioid disorder and alcohol disorder, actually, too. But the fact is, it's medication-assisted treatment. If you don't have those treatment modules, and that means programming to deal with underlying trauma and counseling and things like that, cognitive behavioral therapies and others, but also you don't have those connections from the inside to the outside through a navigator and the case management of a connection to a community health center or a clinic outside, then it's going to fail. So it's the medication-assisted treatment is the way to go.
I wonder, while you put this program together, did you have to sort of change the way you thought about everything, about treating inmates with prescriptions?
Well, I actually had the blessing of, prior to becoming sheriff, I had been a public defender and then a prosecutor and then a legislator. And as Sue knows, I was the chairman of the Committee on Health Care and Public Health. So I had a different perspective than many of my colleagues across the country that are sheriffs. So I had a training in mental health issues, substance use disorder issues, medication-assisted treatment, trauma, all the things that drive people into being justice involved. There's a saying I always say, the social determinants of health, meaning that we have premature mortality rates, are also the same social determinants of justice involvement. And they can be homelessness and mental health and substance use disorder and a failure of social network and a failure in education and so many other things. The very same things that ail people with their health, they ail people that are involved in the justice system.
I'm sure you talk with your colleagues all across the country, even here just locally in Massachusetts. What has their impression been of this? Are they receptive to maybe doing this themselves?
Yes. So actually, we're now every sheriff's office in Massachusetts is doing this type of program. This is not the case across the country, but continually I am traveling to state and speaking on national networks in order to speak about the idea that you can do medication-assisted treatment and to educate people in a way that they need to hear from a colleague. They need to hear from another sheriff, really, to understand it. Not a clinician, but a sheriff saying, it's a good thing you can do it, and you will have good results from it as well.
What about for your employees? The mental health toll on working in this environment must be a lot. Is there anything that you're doing to support them as well? Well,
and it should be we should be mindful of the fact that we're just about to begin Correctional Officers and Employees Week, right? A celebration of the work that correctional staff professionals do every day. It's really one of the most noble professions, and they do an unbelievable job, and they never get the credit that they deserve. But it's such an important component to what we do every day. So yes, this type of job, as with any type of first responder or law enforcement, takes its toll on you. So it's really important for us to be mindful of that, to be looking out for their wellness, to look out for their family's wellness as well. And we do that through employee assistance programs with professional clinicians, also with a peer support program. So we have people on every shift that are trained within our own staff, that are peers, that can reach out to them as well. And we provide supports to not only the officers and the staff, civilian staff in our office, but also the families as well.
I would imagine that once the inmates leave your custody and they're back out in the real world, you want them to continue to make progress, to make strides in this particular area. Do you reach out to family members to try and get them involved and make those connections so that they can stay strong?
Yes, actually in Middlesex Sheriff's Office, we created the very first of its kind family support services unit. No one else had done this, and people kind of forget that the other victims of this incarceration that we never think about are the family members of those that are incarcerated, that are brokenhearted and suffering during this incarceration. So we've actually been providing, we've had well over 2,000 family contacts. We've served over 4,000 family members. We've had, I think, almost 1,500 well-being well-being checks when a family member is worried about the well-being of their loved one inside. They haven't heard from him or her. We can go check and make sure they're getting the services that they need, and we'll also do a lot of remediation with those family members as well. A critical part of their successful reentry is having those family supports, the only social network sometimes that loves them and to support them in a positive way. That's what we try to encourage here at the Middlesex Sheriff's Office.
To that point, right? We don't see them if we're not related to them or have a loved one behind bars. We don't think about them. What's the Frederick Douglass Project?
The Frederick Douglass Project is a really important initiative started by a Professor Mark Howard out of Georgetown. I heard about it. I brought it to Massachusetts. No one else had done it in Massachusetts. It's a program where you bring members of the public in to meet with a cohort of incarcerated individuals. You'll start with an open circle. You'll discuss some general matters. You'll break down into small groups to be able to speak more personally with each other, to see that shared experience you have. Then you'll come out into the larger circle, share those experiences, and then go home. And what's really important is, number one, it's really important. A jail is not a fortress on a hill. It's part of a community. And if you don't have the community's involvement and understanding and belief in what you're doing, then it will fail. So this allows the community to understand who these people are. They're not those people. They're our people. They're our friends and neighbors and loved ones and our children and our parents. But it's also really important for the incarcerated individuals because they see that the community cares about them. And this has been a vast and wild success, something I'm very proud of.
Well, Sheriff Peter Katujian, thanks so much for joining us. We sure appreciate your time.
My pleasure. Thank you very much, Kevin.
Congratulations on being Sheriff of the Year.
Yeah,
that was a great honor. Sheriff of the Year. Thank you so much.
Wow, very good. Thanks so much. Well, we've got an update on efforts to address the housing crisis in Massachusetts.
Several more towns are pushing back against the MBTA Communities Law, which requires municipalities to rezone for more housing near transit stops. Wakefield and Marshfield joined Milton in voting down plans to comply with the law, although they still have time to meet the state's requirements.
Some citizens in Rockport are suing the town to try and block a compliance plan. I asked Attorney General Andrea Campbell about the growing resistance. Take a listen.
This mandatory tool has the opportunity and the possibility to not only create more inclusive communities, but also to help us create housing that indeed can be more affordable. The majority of municipalities are either in compliance or working to come into compliance by the end of this year.
We, of course, can be keeping close tabs on that story, so keep it here on NBC 10 Boston.
That's it for this edition of At Issue. Next Sunday, we meet John Deaton, the attorney and crypto enthusiast who's running for the Senate and is hoping to challenge Senator Elizabeth Warren.
Until then, though, thanks for joining us. I'm Matt Pritchard.
And I'm Sue O'Connell. Enjoy the day.